Folks, Nick the Nurse here. Today we're going to be talking about some of the nursing diagnoses associated with the nursing problem of hypertension or increased blood pressure. And when preparing for your nursing school exams or doing care plans or preparing for the NCLEX, it's very important that you know and understand cognitively what some of the nursing diagnoses associated with hypertension are. One big thing might be ineffective health maintenance. Oftentimes patients who develop hypertension don't necessarily lead the most healthy life. They might have increased sodium intake, they might have increased fat or cholesterol intake, might lead a very sedentary lifestyle. So we want to make sure that we put into the patient's care plan a plan in order to get over the hump of that ineffective health maintenance. Non-compliance, again, in the nursing interventions video for hypertension, we discussed that the topic of how adhering to a lifelong commitment of antihypertensive therapy in the form of antihypertensive medications is very important. And a patient who does not comply with that regimen puts themselves at risk for their hypertension developing into something like a stroke or a heart attack or even something worse, death, unfortunately. So we have to make sure as nurses to put non-compliance, if it's an issue, into their plan of care. Additionally, imbalanced nutrition more than body requirements. And again, I'm certainly not one to talk, but patients who eat too much and are obese might have imbalanced nutrition, and that can certainly lead to hypertension and to other issues. We want to make sure that we understand some of the other things that have to do with hypertension too. These aren't necessarily nursing diagnoses, but they can be included in the plan of care and certainly in your patient teaching. With prehypertension is generally defined as a systolic blood pressure of 120 to 139 or a diastolic pressure of 80 to 89. So keep that in mind. Additionally, you have stage 1 hypertension, which is a systolic of 140 to 159. That's 140 to 159 systolic, or a diastolic of 90 to 99. So you see it's kind of creeping up there. Stage 2 hypertension is when you have a systolic above 160 or you have a diastolic that's above 100. So once you cross that threshold, when you're getting into that secondary or stage 2 hypertension, you're at a very high risk for developing a stroke or having a heart attack or having angina, a lot of these different things that we want to encourage our patients to avoid. So when you're studying for your nursing school exams or for the NCLEX or developing your care plans, keep them in mind, incorporate these things into your patient's plan of care. Again, I'm Nick the Nurse. I want to thank you for watching this video today. If you'd like to see any of my other videos, they are completely free, no obligation, no money down. Just kidding. There's nothing you have to purchase. They're completely free, no commitments. Go check them out, www.nickthenurse.com. I appreciate you watching my video today, and I'll see you next time.